Let's welcome to the studio Dr. David Klein of the Stages of Life Institute. And we call this, of course, our Stages of Life segment of the Rob Newton Resource Hour. Today, we'll talk about asthma and bronchitis and how many people around Central Florida are suffering from that. Take a look at all the people carrying around inhalers. It's unbelievable. All right, doctor, asthma, bronchitis. The floor is yours.
Okay. Asthma is one of my favorite diseases. You know, why is it one of my favorites? Because I've got it. It's been a problem for me since I was a little kid. But there are different types of asthma. There are different types of processes that are involved, and there are different things that you have to do to prevent it, to treat it, and to deal with it. Now, by this stage of the game, most of the people that are listening have already done the damage. Okay, the cigarette smoking, the pipe smoking, the cigar smoking in the house. Very, very dangerous to kids, very, very dangerous to human beings in general, because they have to breathe the stuff in without the benefit of being asked. What does it do? It causes inflammation. It causes scarring of the bronchi and the alveoli. This leads to asthma, which is not a disorder of breathing in. It's a disease of breathing out. So the first thing you need to do is to rewind, undo that cigarette smoking, that exposure, and maybe nothing will happen. Okay, the long and short of it is you got to stop it yourself, because your grandkids are now in the picture, and you will do the same damage to them. So asthma, very, very important. What else can trigger asthma? Okay, extrinsic asthma is very, very common. So it can happen as a result of danders, pollens. Dust mite is a famous one around here, but the big one right now being year-round, is pollen. This is Florida. Florida is an odd state. Okay, it does not get real cold here, but the trees, the grasses, we're seeing pollination occur all the time. If you don't believe it, go out and wash your car. Okay, you'll see this yellow stuff coming off, and I can assure you it's not urine. So what are we looking at? That is what is going to irritate your lungs.
Now, in our hour-long program that we do out of Orlando every Sunday, you talked about one of your patients giving you a very unlikely cure for pollen, something most people would never think of.
Yeah, it's kind of an interesting sort of thing. He was watching me sneeze, cough, and carry on, do a little bit of cursing, stomping, and whatever I had to do to get by through the day because I couldn't breathe real well. And he said, well, I used to have problems with allergies like that, but I fixed it. God, I love it when people say stuff like that. I said, okay, what's going on? He said, well, I just wanted to share this with you. And he told me something very, very magical. He said, get Vaseline. And I'm thinking, oh, this is going to end badly. People, goof on me all the time. It's only fair. Turnabout's fair play. I said, fine. Okay, what am I supposed to do with this Vaseline? He goes, you take a Q-tip and you paint it along the inner aspect of your nose, just the outside. Okay, the outside of the nose. And then as you breathe in through your nose, the pollen will get trapped on the Vaseline.
Brilliant.
It was absolutely spectacular.
Just brilliant.
It was one of the smartest things I'd heard in many, many years. Okay. The guy, I should have paid him for the office visit. I hope he's hearing this discourse right now. Brilliant. Absolutely brilliant. And I'm passing this along to as many people as I can. Asthma is sort of interesting. Now, that being aside, what are the different types of asthma? Okay, you can have your basic extrinsic asthma. Okay, you hit a fume or a chemical. It could be petroleum. It could be hairspray. It could be lots of things that set off the asthma. Could be intrinsic. You'll end up with asthma attacks if you find somebody who's very excitable. That's a very unstable type of asthma. You see that mostly in children. But then there's one called exercise-induced asthma, and this is the one that tends to get missed. Gets missed a lot. So you find yourself, you're doing normally, you percolate along, and then you go into a cold department store, and all of a sudden your chest tightens up, okay? And what's going on here? It must be the perfume aisle, must be this, must be that, okay? You go into some place that's cold, and this is the hallmark of exercise-induced asthma, oddly enough. And up north, we used to see this a lot. The kids would go out into gym class, they'd go outside and it was cold, and they'd double over. That's when they went into their asthma attacks. Down here in Florida, it doesn't really get cold enough for you to end up with an attack like this by going outside, but by going into some businesses or your home, or somebody else's home for that matter, the cold air hits your chest and it tightens up like crazy. Now, you don't really want to confuse this, okay, with chronic bronchitis. Okay, individuals with chronic bronchitis or recent pneumonia, recent tracheobronchitis, They'll also experience this as reactive airway disease, but it may or may not be a permanent. It may or may not be something they're going to have for the rest of their life, as you would with exercise-induced asthma.
So when we get to bronchitis, there are a lot of people suffering from that. So there is a difference between the two, but how do we attack the bronchitis?
Well, bronchitis is a different matter. Okay, it's not that the bronchi are hyper excitable and they start to constrict when aggravated. They're inflamed, could be infected. Okay, and so what happens here is you'll end up with a chronic cough. So the hallmark of bronchitis is a cough. The hallmark of asthma is wheezing. Now there's a lot of there's a lot of crossover here. You can have a little bit of this, a little bit of that. They're rarely rarely do you see perfection. Rarely do you see absolutes. Rarely do you see textbook presentation. But with bronchitis, it's a cough, chronic cough. Now, take-home message on this one is that chronic cough, chronic bronchitis, that's over 6 weeks, 1/3 of these individuals have whooping cough. Okay, that's a huge number. Okay, now whooping cough, pertussis, Bordetella parapertussis, the organism, it can be deadly. Okay, now you can say, well, gee, I've had this chronic cough for 6 years, 8 years, 10 years, or more. But the pertussis bacterium kicks out a toxin that can damage the nervous system and the heart. So you really want to make sure that if you have pertussis, that you get rid of it. What's the best way to figure this thing out? Oddly enough, it's to do something that I absolutely abhor. It's not something that I really believe should be done routinely. In this case, I do. And that's to start somebody on doxycycline. You do it for 21 days. If the cough goes away, you got the diagnosis. It's a whole lot more reliable than trying to do a pertussis culture, actually. You can do blood work to see if you've been exposed to pertussis, but guess what? That inoculation that you got may have given you the antibody, but of insufficient amount.
The doxy worked on me. I had pertussis about 5 months ago, as diagnosed by you in your medical clinic, because I was sitting there for a totally different reason. But everybody in the place was staring at me because I was coughing my head off.
Well, you look like you were going to vomit.
There you go.
People coming back saying, hey, who's this guy over here who's getting ready to cough himself until he pukes?
There you go.
And my patients, for the most part, are tuned into this.
They are.
They'll go, hey, we got another one. It's like the old joke, 12, 12, 12, 12, 12. You poke them in the eye, 13, 13. The joke. It's terrible.
But doxy seemed to take this away in about 5 days,
right.
6 days. But you've got to stay with the regimen, right? Because it's still in you.
It's 21 days, okay? And then sometimes you have to repeat it, okay? Pertussis is one of these very, very slow-growing bacteria, but it's not sitting on the outside of the cells where it's easily killed. It's sitting on the inside. It's just the way these things go. So you have to be patient with it. What's more, okay, is you have to clear the sputum. You have to clear the debris. You have to clear the crud that you're coughing up. So how do you do this? You don't do this by taking antihistamines or drying agents. You do not do that. You have to wet this stuff to get rid of it. So I use a combination of NAC, N-acetylcysteine, and guaifenesin, lots and lots of water, and you're going to start coughing these plugs out. You'll start getting rid of it, and guess what? You're going to start feeling better very, very quickly. But there is a period which is follow-through. It's just like follow-through in a golf swing, a baseball swing, or a tennis swing. You have to do it straight through the resolution and into it's a period of time, about 14 days after the symptoms tend to go away.
Well, and then the problem is once they've taken the doxy, their stomach is void of all probiotics.
It's nuked.
So it's like you have got to go on day, 22 with a prebiotic and a probiotic, right?
You got it, because if you don't, you're going to get sick. Okay, and doxycycline itself is very irritating. Women will come in, they'll go, well, it gives me a vaginal yeast infection. No kidding. There are lots of reasons why this stuff is effective, and there are lots of reasons why you have to follow the rest of the story. It's just the way these things go. But the probiotics have to be very, very potent, and they must be taken straight through at least a month, if not 2. The prebiotics really what make it work altogether. So you take a prebiotic and a probiotic together. What's the prebiotic? I typically have people get something very, very expensive and rare. It's called squash. Okay, if you cook up squash a couple times a day, You can have it with your salad at lunch and some at dinner. It'll give the bacteria something to eat. It gives it the right stuff, as it turns out. It's probiotic fertilizer. You can spend a lot of money if you want to go to the health food store and buy a packaged prebiotic, but I would rather you give your money to charity than to waste it. But a good probiotic should cost you about $1 a day, $1.20 maybe. Okay, but certainly no more than that.
And you're looking for billions.
Billions and billions.
And they had
Carl
that.
Sagan.
There
Billions.
Carl with the stars. And so we have that at the nutraceutical store, so let's find the connection.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.